Hey, Sam.
Kia ora, Adele. Welcome back to both of us in
Yes.
sunny New Zealand.
Yeah.
Yeah, wow. Here in the Antipodes. So today we're going to talk a little bit about your personal journey. And I'm really curious because I know a little bit about what's got you to where you've got to. And now, you work as a trauma therapist and you work with couple relationships and all sorts. So how did you get to here? Tell us about it.
So, there's many, many, many components to the story, as same as your story. Like, I think we'll just, zoom in on one piece. So, when I was still in my mother's womb, she almost lost me. So at 3 months, she actually had to have I think it's called a Sharodka stitch put in. So she had quite a lot of bleeding, and she had to lay very low during the pregnancy. And they found that they'd sort of planned, okay, roughly this is when Adele is coming. But I'd actually been lying in the womb like a little Buddha. So my legs were kind of curled up like this. And I was posterior facing. So my mother had to have this emergency cesarean where both of us almost died. It was quite intense. But my legs were completely congealed when they cut me out. So they couldn't do the usual things you do with babies, where you make sure their legs are properly maneuvering, and you can do that kind of flick where you make sure that their legs are in their hip sockets. And what nobody realized was I actually had congenital hip dysplasia. So I was actually born with no hip sockets, and all this lying like that in the womb like a little Buddha, I didn't actually have hip sockets at all. And so they missed it. And it was about a year and a half later that my parents, for the very first time, because it was like a winter, and they'd sort of, you just dress the kid and then the kid starts walking. So I started walking. And one of their friends actually noticed, like, your daughter is walking really weird, like a bit like a duck, like not
Right.
actually straight. She's walking like this. And it was the first time my parents had noticed it, because it was actually the first time I was in a bathing costume.
Oh,
All the time before that, they'd sort of missed what had happened. And they flagged it and got me to an orthopedic surgeon. And there was just this look of absolute horror with everybody, because usually this is something that you don't miss
well,
when
it's
you're little.
the check that they do, isn't it, when you're born as well? They check all the appendages. Wow, that's a big thing, isn't it?
Big
Wow.
thing to miss, but hey ho, here we are. Um, so, but I think a lot of it was because my legs were so contorted when I came out. But it basically, at the time, fixing congenital hip dysplasia, you have to do something called a bilateral osteotomy, which
Mm.
back then were very unsuccessful surgeries. The kids would constantly re-dislocating out of their hip sockets. So, but there was this new surgery that was being pioneered in Canada, and there was this surgeon called Dr. Dutoy in South Africa, who'd just gone and done his training in Canada. So this was now the very first time this surgery was going to happen in South Africa. And the deal was that I needed to be in traction, where my legs were being pulled out and up, and they kind of wind the little thing, a little click every
That's
few
really
days to just pull the legs out. I had to be in this sort of traction machine for some months. And I'm like 2 years old, right? So I'm in hospital, I'm 2 years old. And back then, the Princess Alice Hospital in Cape Town, the visiting hours were only in the afternoons. And the morning times were time for learning and school and that kind of thing. But the reality was I was in a ward with lots of children. And I really have so many memories of screaming children all around me. Memories of, because I'm lying in this traction, there's memories of the lights. My
yeah.
parents hung a mobile. I remember the mobile. And I remember this feeling and this kind of pressure that, and today we kind of know from a psychological perspective, this pressure to be good or quiet or, whatever, is called pathological accommodation. So I was basically pathologically accommodating to make sure that I got good attention from the nurses and not bad attention. Because all the other kids were crying, but if you get good, you get better attention if you're not crying. But what I do remember, even at the age of 2, was incredible pain. So that's been a real theme for me in my life is enduring incredible levels of pain. And this kind of moving of this thing to move my legs into position. And nobody there to comfort me, and me just needing to be accommodating. It unfortunately led to some childhood trauma. And it's interesting. I spoke to my parents about this the other day, and my mum and dad both, they were so sweet. My mum had some tears, and she just said, it was absolutely horrific to know that every single afternoon I had 2 to 3 hours with you. Yeah. And I would have to leave you, and you'd be screaming as I'm leaving because I'm abandoning you and I'm creating childhood trauma, but it's not my fault.
I know back in the 70s that even mothers weren't allowed to stay with their child. It was cruel.
Yeah. No, it was just horrific. So, and I have flashes and memories of very sort of strange things like, Fisher-Price toy set and little farm animals. And so funny, I live on a farm now, but, little chicken and little like frogs and little ducks and, just like, I remember these weird things. And this is the strange thing is memory lives in the body, and it lives in like deep in the unconscious. And you can kind of, I think as you get older and you're in a safe space, you start to remember things from childhood. And particularly as a trauma therapist, I work with so many people in their 40s and 50s and 60s, and even some in their 70s, that are remembering things that had happened to them when they were kids, but they were never in a safe space to be able to process any of that. So my parents did the absolute best that they could. I mean, the fact that they got me to have this really intricate surgery, because, months lying in traction, and then the surgery, and then months sort of in recovery. And even in the recovery process, I think it was another few months in hospital, and then you get out of hospital and you're in this plaster cast where they fix your legs outward in a position like this. And that was months. And, the whole process ends up taking like almost 6 months to a year. It's like a really, really long time.
Yeah.
Dealing with that.
A little girl on her own in the cot having to manage all of that. Like, that's just huge.
Yeah. I mean, I look back at it now and I see photographs of me kind of lying with my feet kind of up in the air there. And I'm just like, it's just like archaic. It just looks like you're in a rack, like a torture chamber or something like that. But I think, the important parts of it is that I then subsequently, because I was entrapped and I couldn't do anything physical, I became incredibly focused on developing my mind. So at the age of 2, I could already sing all the nursery rhymes. I started reading way earlier than a lot of kids read. I then became hyper adapted in focusing on the brain and on academics. And I've always been focused in that direction, because even when I'd recovered from the surgery and I'm like a little girl cruising around, like I'm not allowed to be on trampolines. I'm not allowed to jump off things. I'm not allowed, the list of what you're not allowed to do in case these hips break, because they had to build hips from grafts of other bones and then pin them. And then there was like second surgery where they got to remove these pins, but keep these pins. And there's all these surgeries and all this stuff going on. But I never developed in the physical side properly. So what I've had in my life is multiple surgeries, multiple medical conditions that it's just like in a side basket of many, many things that I sort of deal with in life. I had to have hysterectomy at a young age. I've had to, connective tissue sort of disorder where I have tumors that grow. I have to have them removed. And so just oh yeah, we'll just go back to the hospital, just do another thing. And then incredible pain, but don't want to be on all the painkillers because, again, based on all the things that I read about, like living on that stuff, it's not really a good thing.
Yeah.
Yeah.
So
So
you've got this incredible endurance.
there's definitely something there, like on pain threshold perspective, that is high. I mean, I've been navigating a surgery that hasn't gone well. It was a foot surgery and complications, and to cut a long story short, we'll talk about it in separately. But it's like, kind of long story short, the nerve actually got entrapped during the surgery. So I've had acute nerve pain where the neurologist was literally like, your nerve pain is like 9 out of 10. And I'm like, yep, I'm well aware of that. But then the cocktail of polypharmacy they want to put you on is just abysmal. It's absolutely like unacceptable to me. It's like an elephant level of gabapentin, an elephant level of opioids, elephant level of, like, let's just go on this channel blocker, calcium blocker, that blocker. And it's just
highly addictive stuff in there too.
And how easily, when you're so fragile, you want to just abdicate to the specialist and go, fix me. But then they don't tell you the long-term consequences. I mean, that's how the whole opioid epidemic happened. And everybody's just doing the best that they can from a medical perspective, but then patients and we don't read enough about the consequences of things, and you don't read enough about some of the other things you can do.
Yeah.
So I was talking to the neurologist, and I'm like, no, I use to help with my pain, I use like a TENS machine on a different part of my leg. It confuses the autonomic nervous system to focus on that kind of stimulation instead of on the leg, or use hot water treatment, or I use other kind of treatments, because I feel I also don't want to numb myself so much that when I don't know that something is changing or something's going wrong, or you kind of numb to everything.
Pain is there for a reason.
Yeah, it's a teacher. And I think not only has it kind of created a sort of resiliency, but I think it's also just fueled my passion for health psychology. That's why I'm doing my doctorate in it. I absolutely love health psychology, because it's, again, that care about whether you have trauma, you have depression or anxiety or challenges in your marriage, or you've lost your job, or whatever's happened to you, understanding that we are the system, that actually we need to care for all these components and lean into them. It is literally what I believe with every fiber of my being.
Yeah. And I also get a greater understanding as well of how you also got into trauma work, and now why that's leading you into your doctorate for your health psychology. Because I mean, you are a health psychologist and you also work in trauma, but I can see the pathways that brought you there.
Yeah, and I think as well, with a lot of, there are many, many clients that I work with that have very, very complex health conditions, and 100% of them, health and the diseases and the inflammation and what actually gets developed is linked to what has happened to you.
Yeah.
You cannot treat these things in a silo.
Yeah.
And you cannot say all these different kind of medical situations and emergencies that I had as a kid. I mean, I had some kidney trouble. I had, accidents, accident prone, and all these different things that happen. You can't separate the two. You can't say, okay, well, no, this is just a condition. We just treat that. That's just in your brain, or that's just in your leg, or that's just in your face. And it's like, what is going on for you at the time? Like, psychologically, how are you? Like, who are you? Tell me more about you, and how did you come to be this way? And I think the curiosity behind that is so important. But I feel very sad for doctors of today that don't have the time, and the medical system, the systems are under so much pressure. There isn't really that spaciousness to have that curiosity.
Yeah, I know. And many doctors are getting burnt out now. They're getting into it because of their love to be of service to others, particularly in the health forum. But yeah, it's the model doesn't lend itself to providing that holistic, um, journey.
Yeah. And I think the other thing that I'm also really passionate about is advocacy, which is the cornerstone of health psychology, is really not to sit back if your gut instinct is telling you that doesn't sit quite right. So I'm not 100% convinced that like I need to be on this cocktail of 27 things or, okay, so you diagnosing that, I'm going to just double check and go get a second opinion. Or, hey, I've told you 6 times that my kid isn't well. When are you doing something about it?
Mm.
That is a whole thing that is so incredibly important. And we see it. You and I have talked at length about how much we see this with clients that we have in New Zealand, clients in UK, US.
Yeah.
There's this blind trust and kind of almost complete abdication that we do. And empowerment and taking control and educating yourself on everything is really important. I mean, due to my kind of like nerve condition with my foot, I've read all the things now. I literally feel like I could talk at a peripheral nerve symposium if you asked me to. Like, yes, is it innovating this way? Or like, are we doing compression or are we doing neurolysis? Or just totally diving into understanding, because that understanding builds competence and it also builds scrutiny.
Yeah.
And that scrutiny is really crucial to be able to test, is what you're telling me, do I buy it? Do my symptoms line up with what you're saying?
Yeah. And I think part of your advocacy is that you like to educate people too. And so then that helps people make informed choices, okay? Because if you've got knowledge, it's powerful in helping you in the direction that you want to move forward in, right? So I know that that's something that you're really like passionate about.
Yeah, big time. And I think not just education, but to inspire people to self-educate.
Yeah.
And to actually not just take at face value what someone says to you. And that's not just the case with your health. It's actually the case with everything. It's the case with dating.
Yeah.
Don't just take at face value. Someone's like, oh, I'm a very kind and caring person. Oh, okay. Yeah, you are, because you said so. That's amazing. Yeah, thumbs up to you.
Yeah.
No. Where's your due diligence? Where's your check? How do you know that that's the case? And if somebody says this is your diagnosis, well, how do you know that? Does it line up with the symptoms? Have you actually done some research? And with the dawn of AI, it's actually very empowering for us to be able to broaden our ability to do research.
Yeah.
But I think what happens is there's a kind of, I don't know if it's like a laziness, but it's like a lack of curiosity. Oh, I don't want to know that. Like, I've seen that he has, and you watch Love Island or Married at First Sight, and you see how these people, like, what are they falling for? No, they had big muscles and really strong jaw. He must be kind and caring. And I'm like, your science is amazing. How did you extrapolate that? This is your dream person based on 3 pieces of data. How did you get there? Wow, let's totally check that out.
Yeah, it's so interesting, isn't it? That people, it amazes me how humans take everything at face value. And I think you're correct. I don't think it's laziness. I think there's some inhibition with curiosity. For whatever reason, people are busy or people just aren't interested. Adults in particular learn on a need to know basis. So often adults have to reach a crisis point before they might go off and be curious about something. So there's lots and lots of reasons, but yeah, like humans take things at face value. They go, well, X, Y, and Z is that. And you go, well, where's the evidence? And they go, well, I don't have any evidence. Like Charlotte told me. I'm like, oh, okay. Yeah. Yeah.
And it's kind of, it's sort of, it saddens me because in some ways, what I observe from a psychological perspective with a lot of people that I've worked with, the lack of curiosity is, I get the image, the image of people that are like this and like this.
Mm,
I don't want the bad news, and I don't want to hear anything that I can't handle. So
mm,
it's like a safety mechanism in a way. Like, I don't want to delve deeper and find something I don't like. I
mm.
just want to stay in my little cocoon and just give me my tablet and everything's going to be okay.
Yeah.
So, but what, and then when something's not okay, we get to play the victim. And then we get to say, it's your fault it's not okay because you told me to take the tablet and you told me to do whatever. But where is the self-responsibility?
Yeah.
Where's the ownership?
That's right.
Where are we determining our own course based on taking control of
Yeah.
that education for ourselves,
Yeah.
asking critical questions, double checking things? Yeah, sure, it is a lot more work, but then you are truly in control of the fallout of whatever choice or decision you make.
Yeah. And that's something that we have talked about at length as well, is about taking responsibility for what you can take responsibility for. But there's also something in self-advocacy, okay? It's really tricky for some people to self-advocate, because self-advocacy can also have like a punishing aspect to it. Like somehow there's something wrong with you, or so talk to us more about that.
Yeah, it's almost like if you advocate for yourself, you're just dramatic. I
Mm.
see that a lot, like, mansplaining or medical gaslighting, like, oh, here she comes again asking a million questions, like, and therefore you almost feel, I go back to that kind of pathological accommodating, like, okay, I'll just sort of lie in the quiet and I won't upset any apple carts. And I've had to really force myself to focus more on the result that I want to produce, as opposed to, do you like me at the end of this engagement? Because this is my health, my well-being, my life. Like, in the same way in dating, or in scrutinizing, like whether I want to take this job, or in a lot of big decisions we make, if we don't self-advocate, we cannot then play the victim afterwards. We've actually, in going along with the story,
Mm.
we've actually chosen. By not choosing, we've still chosen. By not asking questions and not doing due diligence, we've still chosen something. So
Yeah.
self-advocacy, if we don't do that, we injure ourselves actually. But it is difficult because there's a shaming that happens amongst authority figures if you self-advocate. It's
Yeah.
almost like, no, I know best. And this hierarchical thing, that the world that we live in. But
Yeah.
what I'm loving about social media, AI, all these changes that we're seeing, one of the most unscary parts of it is it's flattening the hierarchy.
Yeah. Yeah. And for many, self-advocacy can be a really courageous thing. And
Yeah.
then end up shamed after building the courage to advocate for yourself. Can put people off doing it again, right? Like
Mm.
it's such an interesting process of a hierarchy of systems. Um, yeah,
Yeah.
and that's something that you have had to do for yourself, and currently doing with your your foot problem at the moment, is that
Yeah,
you.
and I do it a lot. There's some clients I work with that cannot advocate for themselves. I had a client who had a traumatic brain injury and she wasn't able to advocate for herself. And there you know, we talk about mothering energy. I'm like a lioness when I go into advocating mode. Like, if there's like a lawyer or something that gets exploded in me, and I'm just like, no. Like, we will get a different solution and a different outcome. And luckily, I've had some successes with some people that I've worked with that has been life-saving. Some people that I've worked with that are on cocktails of 27 meds a day. They've got scurvy. Their teeth have fallen out. They literally have like medically induced lupus. They have, because the cross combinations of all these like cocktail of drugs that they're on were never checked by whoever administered them, because everyone who administered them in their silos.
Yeah,
And
that's
the
right.
poor GPs, they get 7 minutes to review each patient because there's this pressure to keep like turning people through the system. So the system is struggling, is really struggling with all these components. And I don't think we can hold any one person like personally, like it's your fault. It's like, and it's endemic in the system. So it's just challenging. So that's why self-advocacy is so important. And you got to get yourself to a place where you don't care if you're disliked. It's almost the courage to be disliked, the courage to actually go, no, I don't agree with you and I don't feel comfortable with this. And I want to see the science behind what you've just recommended. And I don't like what you're saying. Or, just actually speaking up.
Feel the resentment and do it anyway. That's right. I said that to one of my clients yesterday, not around resentment. I just said that you got to feel the burden and the guilt, but you got to do it anyway. This is around taking early leave because needs must. I won't get too much into the story, but it's not negotiable. This person has to stop working for various reasons. And so I said, look, she said, how can I work through this? And I go, well, you actually just have to feel the burden and the guilt, and you actually just have to do it anyway, and it will soften.
And this is the reality of I know we'll do an entire episode on pathological accommodation because I'm super passionate about being one of the people that, is keen to recover from that and help other people to recover.
Yeah.
It's that anytime you speak up and you actually start advocating for yourself, you are interrupting a very intricate system that needed you to remain in the box that you were put in.
Yeah.
So when you stand up and say no, you're actually upsetting the apple carts of multiple humans that are in the system.
Yeah.
They're not going to like it.
Yeah.
It's not going to be an enjoyable journey. So you are literally exploding your life by standing up for yourself, which is why people stay exactly where they are. They stay in the comfort zone. They avoid the conflict, but they get sick. They get ill.
It can rupture relationships. And that's one of the painful thing, I think, for people is that by standing up for self and saying no, and people are like, oh, and so, it can rupture like the system that you have in your relationship with others. But we'll do a whole episode on that, I'm sure, or even a couple. Like, it's a big story, that one, isn't it?
It really is.
Yeah.
Okay. Yeah. So I think that's probably enough for today's episode. I'm sure we'll share more of our stories.
Yeah, it's been good to hear. Thank you for sharing.
Awesome. All right. Till next time.
Okay. Take care. Bye.
The information shared on the Naked Insights podcast is for educational and information purposes only and is not intended as a substitute for professional therapy or counseling. While we aim to provide helpful and accurate insights, individual experiences may vary. If you're experiencing trauma, mental health issues, or distress, please seek guidance from a qualified professional. The views expressed by us as the hosts are our own and do not necessarily reflect the opinions or positions of any affiliated organizations.